Hello and welcome to another video from me, the student. In this video, a quick revision video about public health in the 1800s. So watch this video a number of times to help revise your knowledge. I'll be talking about all the key facts and all the key information about public health in the 1800s, in particular with a focus on AQA skills as well to help you revise. And then do take a look at my revision guide, practice some questions, or look at some of my free videos to practice your skills on this topic. Okay, so now over to the key content. So we start our public health in the 1800s by thinking about what it was like at the start of the 1800s. So we've had urbanisation taking place and places are getting more and more crowded. So the countryside has become mechanised and farm labourers are becoming unemployed and now moving to towns and cities to work in factories, mines and mills. And when they arrive, the towns become more and more crowded and the conditions of the poor are very bad. They worked long hours for low pay in the factories. Often women and children worked as well in these factories, mines and mills. Conditions were very dangerous. You may remember, stories from your earlier education on industrial revolution with children trapped under machines or children working in the mines with explosions. So all those dangers existed. So early public health problems of this rapid industrialization led to the crowded houses and the poor tenement buildings. You can imagine the workers' cottages all crammed and crowded. And tenement buildings, you may remember, sort of 10, 12 people in a building, one family per room. Okay, so these poor workers were often living in these houses that lacked sewers, lacked water supplies, and the houses were cramped with poor ventilation. So diseases spread rapidly. Okay, so our first big moment we've got to think about is the 1834 Poor Law Amendment Act. So this is public health because it's the beginning of welfare state improving, or the government doing more to improve the lives of the poor people. So they have money, they can have a home, they can be better looked after. So Edwin Chadwick worked on the 1832 Royal Commission into poor laws. This is a government factor, and they concluded that the poor still were a little bit lazy, and so they needed workhouses to keep them with a roof over their head, food on the table, and make them work to ensure they got their care. This might be partly due to the 1832 Great Reform Act, a political change which gave middle-class people more votes. They, along with the rich people, wanted firm help for the poor. They didn't want them sort of lying in the streets, being beggars. They wanted them with a roof over their head, working. Okay, again, linking back to that sort of idea that maybe the poor were considered a little bit lazy. The 1834 Poor Law Amendment Act organised parishes into unions to run workhouses for the poor. The poor had to work in these workhouses to pay off their debts. Conditions were obviously not very good. People feared going to the workhouse. It was like a prison for the poor. There were different workhouses for children, women, men and elderly, so often families were split up. Some of these workhouses were run by the church, so therefore religion becomes a little bit of a factor. Think about stories like Oliver Twist, and Dickens's story of Oliver Twist is a criticism of the workhouse system. So then Chadwick continues his work by looking at conditions for the poor with his 1842 report. So Chadwick believed in miasma as a key cause of disease, and he was a civil servant who led this commission into what was called the sanitary conditions of the labouring population, which gave a report in 1842. Chadwick started to come up with a sort of slightly new idea. The poor were unreliable, but their unreliability was not due to laziness, but it might be due to illness, due to their bad living conditions, which was a big change from what happened in the early 1830s and in the years before. He said they were ill due to damp houses, poor ventilation, dirty conditions, waste and sewage, and lack of good food and clean water, the problems of urbanisation. Chadwick recommended a board of health and health inspectors lead improvements to people's towns, to clear the slum housing, build sewers, improve waste removal and clean the water supplies. This led to our first big government act to try and deal with this, the 1848 Public Health Act. Due to Chadwick's report, the government brought through this act that included a board of health, health inspectors, slum clearance, sewers, waste removal and clean water. But the act was not compulsory. Councils chose whether they brought in the act or not. And obviously the rich ratepayers still thought the poor were a bit lazy, didn't want to pay extra taxes to pay for the poor. So there was also a strong belief in the laissez-faire idea at this time, which was an idea of not interfering in people's lives quite so much. People should sort their own lives out. So now on to the next important thing that happens for public health. We've got John Snow and cholera. So cholera obviously is a big disease causing lots and lots of problems. We might remember outbreaks in the 1830s in the textbooks, places like Exeter, places like London, the picture of the tar barrels in the streets suggesting that miasma idea. But John Snow believed it wasn't miasma. He said, well, how could it be so random in its occurrence? Surely the whole town would suffer the bad smell, the miasma. Why was it located in such a random pattern? So Snow investigated the theory that cholera might have been caused by dirty water in 1854 when an outbreak took place at the Broad Street area of London. John Snow's famous investigation, he plotted all the deaths on a map. He looked into the deaths around the Broad Street pump area and all the cholera deaths around the area. So some deaths were quite far away from the pump, so he investigated why a rich lady had died and found that she had the water delivered from the Broad Street pump. She liked the taste. Some people didn't die in the Broad Street area, and he investigated why that was. So the brewery workers drank the beer, so none of the brewery workers caught the disease. So of course the conclusion was, in the article that Snow published, was that the water was causing the cholera. People like Farr and Chadwick, health commissioners, disagreed with him. They believed it was miasma. But Snow had the handle removed from the pump and the cholera outbreak stopped. And investigations found a cesspit, which is obviously a toilet waste pit, had leaked into the water for the pump. Farr and Chadwick argued this was still miasma because the bad air had got into the water. Okay, a third thing to consider, as well as Chadwick and Snow, is Bazalgette and the sewers, and then an event interestingly called the Great Stink. So London sewers were overflowing. They were old Roman sewers, and drainage sewers were being used and now being used for toilet waste. And this was made worse by the invention of the toilet or the water closet in the home. Things like Thomas Crapper's flushing toilet. But where did the flushed waste go to? Well, it went into old drains and old sewers that couldn't cope. So this leads eventually to an event called the Great Stink. So cholera outbreaks in London and Exeter led people to believe that the smell of the sewers was causing disease. So London decided to flush out the sewers and empty them of all the waste into the river. And so by 1858, in a warm summer, the river stank. And it was called the Great Stink of 1858. Parliament was abandoned. People fled London in fear. But when Parliament returned in 1859, they granted Joseph Bazalgette, an engineer, £3 million to build a sewer network for London to remove the stink. By 1865, the pump houses, the sewers were opened for most of London, and the miasma seemed contained. There was a small outbreak of cholera in the East End, but by 1870, when the whole thing was done, all the water treatment facilities complete, there was no more cholera. Seemingly, it had contained the bad air. But we had this story of 1848 that the first Public Health Act was not brought in due to laissez-faire ideas. But by 1875, a compulsory Public Health Act is brought in. So why is this? How has this happened? So here are a number of reasons why. So number one, the death of Prince Albert, Queen Victoria's husband, in 1861, suggested to people that it wasn't just poor people who died of these diseases, rich people died too. Albert died of typhoid, a poor person disease, because of the bad drainage and sewers at the palaces. Secondly, germ theory of 1861 had showed that dirt and disease could be linked. So this gave the idea of improving public health. There were germs around because of dirt. Germs might cause disease, so you've got to clean up the waste. Thirdly, the 1867 Voting Reform Act gave more votes to working class people. So now members of Parliament, if they want to be voted into power, had to offer things to the poorer working class people, like better housing, better public health, better conditions in the towns. The fourth idea is government statistics. The government had been tracking death rates and life expectancy, etc. since 1837. They could now see the impact of the public health reforms. Places like Leeds, that had brought in all of the Public Health Act of 1848, their life expectancy went up. Fewer people were dying of diseases like cholera. And London, after the sewers of Bazalgette were brought in, life expectancy went up. Fewer people dying of cholera. A pattern emerged that public health reforms were doing good. And another factor is the slow end of laissez-faire policies. By 1875, the government was bringing in lots and lots of laws to interfere with people's lives, and they were having great success. 1852, the compulsory vaccination against smallpox. 1864, the Factory Act to ban unhealthy conditions. The Sanitary Act, local council had to start looking at building sewers and clean water supplies. Slum Clearance Act to remove and demolish slum houses. Primary Education Act meant the children had to go to school and they didn't work in the workplace anymore. So lots and lots of things started to develop. By the end of the 1800s, there had been some improvement. The Public Health Act was forced upon the people. Houses starting to be knocked down. We've got better houses starting to be built. We've got generally better public health starting to emerge. But there still were problems. So the child death rate remained high in the late 1800s. 160 deaths per 1,000 live births under one, equated 16% of babies dying still. And a Burward in the early 1900s suggested, and other reports like the Roundtree Report and Booth Report, suggested that health was still very poor. So let's have a think about some of the significance of some people of importance. So Chadwick is significant. We think about our lists criteria. He, in the long term, made the government more involved in the health of the people. The end of laissez-faire ideas in the long term and the impact the government will continue to be involved in the 1900s with the liberal reforms, the welfare state. Importance. Disraeli, the Prime Minister, passed the law. He's a famous Prime Minister for doing lots of amazing things, and he passed Chadwick's ideas and supported them. Size and scale. So thousands of lives are saved and impacted through his Conditions of Poor report. The idea that it's not laziness anymore, it's bad health, bad conditions. He changed a mindset for thousands of people impacted. So the government today believes it's a role to keep people healthy, thanks to changing mindsets like people like Chadwick led to. So COVID lockdown in recent times is a good example. So short-term impact, obviously his report led to the 1848 Public Health Act, and this improved conditions for towns like Leeds that introduced them, and eventually by 1875 when laissez-faire ideas ended, they led to a nationwide improvement. So Snow's a really interesting character, and he's obviously important for surgery, but he also has an importance for public health as well. So in the long term, he showed disease could be carried by dirty water, and this was proven by Robert Koch's discovery of germs causing disease. His importance, he was an expert anaesthetist, and it was anaesthetist to the Queen. He was well respected, therefore people listened to him, and his opinion mattered. Obviously, he saved hundreds of lives just simply by taking the pump off the Broad Street pump and stopping the cholera epidemic. And obviously, thousands of lives in the future were saved by promoting of clean water. Campaigns did start to develop after his work in newspapers, etc., criticising water companies for their dirty water. Today, we follow his example of excellent investigation. He's an epidemiologist, people who investigate why diseases are happening. He could even be the father of epidemiology. So, short-term impact, by taking the hand off the pump, he obviously stopped cholera. So what about the significance of public health acts? So in the long term, they inspire modern public health. For example, the improved housing built in the 1930s and 1950s in the next century. This was slum clearance based on the Public Health Act. Importance. Leeds brought forward lots of the reforms, and by the 1860s they greatly improved the health of the people. London started to follow suit, so important places were impacted. Size and scale. The 1875 Act was compulsory, so affected all the people across the United Kingdom over the next decades. Today, governments still continue to develop public health, and they control it, and they try to interfere in people's lives to improve people's health. Now we have something called Public Health England, which monitors public health and ensures it's of a good quality. And finally, his short-term impact. People were inspired by his ideas, but they realised by the 1900s it wasn't quite enough, so they had to bring in more things to help, like the liberal reforms. But without his ending of laissez-faire, with his pushing for acts like the Public Health Act, the liberal reforms might not have happened. So finally, factors of change. So we've got lots of factors of change we need to have a think about. So government obviously is a massive factor of change. They're organising lots of things now. Laissez-faire ideas have ended, and they're bringing in things like the Poor Law. They're investigating with the Sanitary Conditions Act that Chadwick led, bringing in Public Health Acts, Vaccination Acts, Factory Acts. The local government of London's bringing in the sewers. The only problem was really it took so long to happen. When you think that the laissez-faire ideas took till 1875 to end, if they come in 1848, it could have made a big difference. Individual genius, we've got Jon Snow's amazing investigations into cholera. Unfortunately, people weren't quite ready to listen to it, which was a shame. We've got religion. The church helped set up workhouses and was involved in the poor law to help people. Communication, we've got lots of reports here, obviously, into sanitary conditions by Chadwick, for instance. We've got Pasteur's germ theory really inspiring change as well. What about question 3, the similarities question? So comparing Renaissance and Industrial Revolution public health, we've got some important ideas that are similar. So for instance, both government are improving in both time periods. In the Great Plague in Renaissance time, the government's really getting involved. Obviously in the 1800s, the government's ending laissez-faire ideas, their public health acts, vaccinations, sewers, all improving. As a more basic idea, both time periods still believe miasma is important, and to some extent that idea is helping. So in the Great Plague, obviously their belief in miasma leads to quarantines, and they stop people moving around, stop bad air moving. Chadwick and others believe in miasma in the 1800s, and this leads to his report to help the conditions of the poor in 1842 and inspires the Public Health Act. So even though both time periods have got a wrong idea, it is helping. And wealth in both times is quite important as well. Rich people in the Renaissance time are paying for gong farmers' cesspits. They are funding the poor law reforms. And again, in the 1800s, they are the ones paying the taxes for the Public Health Act and the London sewers that are having such an impact. Sorry, please allow me to interrupt just for a moment to tell you about some of the other services I offer. So look at my website, historytutor.co.uk, to find out more about history tutoring if you want help directly one-to-one, or if you've got a small group of friends who want help, then look me up. Also, if you want more information about my revision guides, they're available on Amazon. They are packed full of revision notes, all the essential facts, organised into revision cards or simple forms you can just look over again and again to revise. Packed full of videos helping you answer the questions. I tutor you through how to answer all the different types of questions. Lots of videos explaining how to do this. Some of them are free on YouTube. Look me up for more videos, but you'll find more and more videos on my revision guides. So take a look. Okay, well, hopefully you've now solidified your knowledge by watching this a few times and you know all your key facts. So do test your skills with my other videos or using my revision guide, and do subscribe for more information, more ideas. See you again soon. Bye bye for now.